BBI has, our staff has extensive experience in healthcare projects. We have done everything from nursing homes to hospital renovations, to MRI suites inside of hospitals, heart health centers, freestanding clinics. We've done probably over $120 million worth of projects. Hospital projects are very complex to begin with, from a regulation and a design standpoint, but also from a human standpoint, and that you have the administrators and you have the users who are the caregivers, and then you also have the patients. And you have to think of all three of them to do a really good job and deliver. Because of our broad range of experience, we really understand the importance of working in a hospital setting and the complexity of it, not to mention the guidelines and rules and regulations that we have to follow and that you must maintain during construction, but also in the fact that we have to meet your goals as an administrator and taking into account the caregivers and the patients as well. When we're designing these projects for healthcare, one of the paramount things that we keep in mind is really trying to enhance the facility to reduce the anxiety for both the patients and the family. When we meet with clients, we really focus on listening. What are your issues? What are you trying to achieve through architecture? What are you trying to achieve when you hire us? We listen. We come up with lots of approaches. Sometimes it's about a physical building, other times it's about creating an environment. One example that we have was a nursing home renovation, and we took the approach that it needed to be more home-like, so we deinstitutionalized the nursing home by removing nurses' stations, breaking up those functions and putting them closer to where the residents are, and then we go ahead and just incorporate elements of home. And we took it a step further by incorporating residential kitchens back into the home. When you get sick and you're old and you're frail, you want your home more than anything, and yet you're plucked out of it. And so if you can bring elements and creature comforts of your home back in, such as the smell of fresh baked cookies and having a fresh brewed cup of tea, we found that was important, and that was something we could give back.
When we take on a healthcare project, we really take the time to understand what our client is trying to accomplish. We work with everyone in order to create environments that are comfortable, functional, and private. Many times we're able to add just a little something extra that means a lot to the people using the space. That's one of the ways that we design spaces at work.